Hello, NBC, and let's finish up Chapter 5. This is our second lecture video, and we're going to start on vital signs. So, share. Well, I would love to share, but something keeps popping up in front of it. There we go. So we're going to finish up our slides, but before we get into our slides, this is going to be an assignment. The assignment is to finish this phrase. If it is not documented, and fill in the blank. I'm going to be expecting this to be turned in, attached to this lecture video. All right, so let's move on to vital signs. So what are vital signs? They are objective findings such as temperature, pulse, respiration, and blood pressures. Anthropometric measurements, let me try that again. Anthropometric measurements are height, weight, body mass index, which is BMI, head circumference, and that's for infants. You're going to be learning about vital signs and how to input those in your SIMS charts on EHR exercise 5-9. Let's talk about order entry. And again, you're going to get practice with this from EHR exercise 5-10 through 5-12. It's computerized provider order entry, or CPOE. One of the best ways to decrease the number of errors and protect patients. And system automatically checks for safety and appropriateness. So problem list. I am sorry, guys, they're working on our roof and there's so much background noise, and I am really trying hard to overcome the noise and speak correctly here. So problem list. You access the problem list from the record drop-down box. You're going to be doing some practice with this in EHR exercise 5-13 as well as figure 5-9. So problem list is a part of meaningful use requirements. It allows provider to identify most significant health concerns, identifies disease-specific populations, helps to evaluate standard measures for providers and organizations, and identifies patients for responsible research studies. So tracking health screenings and immunization. Children should be given recommended immunizations, and adults should be vaccinated and screened for certain diseases, as indicated by their age, risk factor, or both. A patient's insurance may or may not cover certain types of screenings, so patients should check with their carrier before having them performed. In EHR exercise 5-14, you will be getting practical practice with this. So health information often reaches patients in bits and pieces. Clinical decision support tools in the EHR can help providers by showing them which conditions the patient is at risk for, flags the patient's chart. Patients should also be health literate. So you're going to run across a lot of people who don't have understanding. You're just going to have to take extra time with those patients. Using the EHR for patient education. Although the main purpose of the EHR is to document patient-physician encounters, the EHR is also a useful tool for educating patients about their health and risk factors for disease. Proper communication skills are needed for the patient to fully understand the instructions. So let's read our slide. It says the EHR contains data collected over a long time, allowing attentive clinician to identify long-term trends that indicate elevated disease risk. Guidelines for effective patient education. Speak with the patient in a quiet, well-lit area that offers as much privacy as possible. Take your time and don't rush as you explain the material. Provide both oral instructions and supplemental printed instructions from the EHR. Guidelines for effective patient education continued again. Encourage your patient to ask questions as needed. Have the patient and caregiver demonstrate skills before leaving the office to ensure that proper technique is used. And encourage patients to contact the office at any time with additional questions. You're going to be learning this and putting this into practice on EHR 515. The progress note. We call this the SOAP note. Guys, you really, really, really need to memorize this, learn it, write it down, make flashcards. It's important. So accurately recording the details of a patient encounter ensures that the highest level of patient care decreases the risk of lawsuits, establishes evidence of illness, and documents the treatment plan. So let's see, S stands for subjective, and that's what the patient tells you. The O stands for objective, information that can be observed, measured, or collected. Example is vital signs. Assessment is a summation of the diagnosis or the impression of what's wrong with the patient. P is plan, the steps the provider plans to take to treat the patient. E is evaluation or education. The E section is not always used by providers, but when the information is documented, it includes advice to the patient regarding treatments, advice to patients about disease, and future issues in response. What I want to tell you about that is the word advice is used, and you do not give advice. That is out of your scope of practice. You just give information, educational information that can be paper or referred to in a website, but you're not going to say, hey, Mrs. Johnson, I think that she should take this or blah, 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 blah. No, you never give advice. You leave that to the physician. Digital signature. Although a batch of notes can be signed at once using the EHR, doing so may cause Medicare compliance problems. It's more prudent to sign the notes one by one as they are reviewed. When a note is signed electronically, the provider is representing that everything within that note is corrected. A notation of when it was signed and by whom is shown below the signature line on the saved note. Okay, that is the end of our slide for chapter 5. Okay, so I want to review a couple of words that are very, very important, and you're going to need to know this all through this course. The word acute and chronic, and so we're going to go back over those again. Acute conditions occur suddenly and are usually severe but brief in duration. Chronic conditions are those that persist over a long time or are reoccurrent. So I want you to remember that. It's going to have a lot to do with coding, and those of you who have not been through much coding, you're going to need to know those words, acute and chronic. So we're just reviewing those again. Remember that you have a little assignment that you need to attach to this video to get credit for it. And if you have any questions, let me know. Otherwise, happy sim charting, guys. Talk to you later.